Finally, let me discuss an issue that is a great concern to me, to members of this chamber, and to the public. And that's how we pay for this plan. Now, here's what you need to know. First, I will not sign a plan that adds one dime to our deficits, either now or in the future. Second, we've estimated that most of this plan can be paid for by finding savings within the existing healthcare system.
Estimates range from 20% to 30% of our healthcare dollars go into red tape, paperwork, profits for the private marketplace, and so forth. Conceivably, it is possible to capture those savings and apply them to provide coverage, in theory. But transitioning a system is a very difficult and costly and lengthy enterprise. It's not like you can turn on a switch and you go from one system to another. So it's possible that up front you would need not just, you might need an additional $90 or $100 billion a year to provide coverage, with the understanding that you would capture savings over the long term as the system transitioned. And the question then becomes, how do people feel about paying additional money? Let's say that I proposed a plan that moved to a single-payer system. Let's say Medicare Plus. Essentially, everybody can buy into Medicare, for example. It would cost a huge amount of money. We're going to have to come up with at least $15 billion in new money just to maintain the existing coverage that's provided to kids through the S-CHIP program. There are an additional 6 million, I believe, children who are not covered, but who would otherwise be eligible. So we'd have to come up with some additional money to cover them, to make sure that every child has basic coverage. And I think it raises then the issue of cost. And that's why there have been a couple times where I've pushed people on the idea of paying higher taxes in order to implement the system. And by the way, that's an area where we should be willing to make an investment up front, because there may be community hospitals in rural areas, for example, that can't afford to set up the computerization and the software system. The federal government should subsidize that initial process.
Being a healthcare provider, I see that Medicare, Medicaid pays 62 cents on the dollar.
You're right that Medicare and Medicaid, oftentimes politicians use those two systems as a way of, as a sort of a safety valve in the budget, particularly at the state level. So what they do is, if they get in a budget crunch, they will delay payments to doctors, or the reimbursements won't be quite as high, and force providers to suck up the costs. Then one of the things that I want to find out is whether folks are actually ready to move off an employer-based system.